Yes, many thanks for staying with us on Frontline this morning. Now we'll move on to the interview segment of the show. Nigeria as a country is known for a rich culture and diverse population, but despite this, it still faces with a lot of challenges ranging from poverty to economic instability and also a lot of issues around the world, which is also affecting Nigeria as a country. But despite these struggles, we have countless number of individuals, communities, and organizations stepping up through humanitarian effort, providing relief, hope, and support for those in need. So this morning we are looking at the art of humanitarian work in Nigeria. What does these people do to make life or to shape the future of Nigerians and to make life better for them? Thus, on the program this morning, we'll be discussing humanitarian work in Nigeria. And joining me to have this conversation this morning is Mrs. Blessed Peter Akinloye. She is the founder of Blessed Health Spring Initiative. It's a non-governmental organization. She's going to talk a bit on what they do at BHS. But before then, join me to welcome Blessed Peter Akinloye on the program. It's good to have you on the show this morning.
Good morning, Ma. Thank you very much for having me.
All right, so let's start by first looking at the basic. Talking about humanitarian work in Nigerian context, how would you describe it? And if I ask you to rate our humanitarian work as a country on the scale of 1 to 10, how would you rate it?
Thank you very much. Humanitarian work in Nigeria is actually multifaceted in the sense that individuals, communities, leaders, religious organizations, even the government are working to ensure that Nigerians have better life and meet the issues in Nigeria, the economic crisis and all. Starting from social media, we could see individuals do a lot of things. You know, they could play games and give gifts. Some people want to surprise the homeless on the streets. You see individuals, some celebrities, they come to organizations, NGOs, young people. Mostly in this generation, I think young people are just on the forefront. Most of them, they have ideas, they see problems in their communities, they just look for solutions, and they do something wow. Let me put it that way, something to just impact life, to improve health and improve the living condition of people. From young people, from the ideas they form organizations, they start up initiatives, they have the big organizations out there, they have the government, or everything that just going to just ensure that life goes on. Of course, you know how inflation is. Food, to even get food to eat income is quite difficult. But yet, young people go out on their way to just see how they make life better. With or without the government supports, seriously. With or without international supports. Most times, these people do it from out of pockets. Yes, out of their pockets, because even as young organizations, to even get support from the big is quite difficult. Friends, families, support, and so I rate 7 over 10. Nigerians are good people.
It's fair enough.
Yeah, Nigerians are good people, and we care to some extent. We actually care, Some time ago, in our community, I just looked at it. Okay, that was during the COVID-19 period. Yeah, that's 2020. As much as the outbreak was everywhere, and we were putting up measures to control, to ensure people to educate them about prevention and all. I just discovered that to even eat was difficult. People were scared. They were all indoors. That time people were just indoors, sit at home. I was like, okay, let's do something. Let's do a COVID-19 relief project in the community. I reached out to friends, of course, and I reached out to friends, reached out to people. So person doesn't have food to eat. Let's do this. Instantly, within people we are able to gather resources to ensure that we reach out to people with foodstuffs and enlighten them about COVID-19. So I think in Nigeria, humanitarian services and humanitarian work is actually on the higher side, if I should rate it. And we are there, but then we have our challenges.
Okay, before we talk about the challenges, let's talk about the challenges of Nigeria. Like I mentioned during the introduction, that Nigeria is a country that has its own baggages, ranging from insecurity, poverty, economic instability, and all. How do all of this impact the scope of humanitarian in Nigeria, humanitarian work in Nigeria?
So maybe we start with the security concerns. Up there in the north, we have issues of the Boko Haram. Boko Haram, we have kidnapping. Even down here in the west, we have community conflicts. These things hampers the impact of humanitarian services. Imagine you have an organization in the north and they're going out. They just kidnapped your car. Sometimes we don't want to go there. And then we have the issues of logistics, poor road networks, communication network. That's so most people that need these humanitarian services are in the rural areas. And then we should not forget that the root of all this is poverty most times. Yes. And so to even get to those unreached persons, it could be very difficult. Most of you just need bike. And then a bike could take you like 2 hours in there. They have bad roads. And so when you get to a place and then you don't have network on your phone. So these are issues. And then we then go down to poor financing, poor resources and financing. Most of these NGOs, most of these organizations, they want to do something, they want to reach out. Even some people doing something in the bed, in the community, just down at the grassroots. They don't have access to funding. And they are the ones doing the real work in the community. So most times it's actually a challenge to them. And then we have cultural issues. Nigeria, we have about 250 ethnic groups and different languages. And so you see that it's actually a challenge. Most times you need an interpreter to interpret. Most times you just have to adapt. And then you have societies communities where they don't just, where women rights are not acknowledged. Let me put it that way. Let me just put it that way. Where women are seen to be lower, you find it difficult to penetrate such communities with projects or programs that would impact the life of women. So you just see that even community participation and community outreaches could be very, very difficult. Another thing I would actually want to talk about in that sense is polarized intervention in Nigeria. Okay. It's actually a problem. Where we see, what do I mean by that? Most times, even when you go online check, most of the supports for humanitarian services are channeled to the north. Now, you could say because of the lifestyle. Yes. Okay. Yeah, to the north, we talk about. They are vulnerable? Yes, they are vulnerable, the lifestyle, the culture. When it comes to, they have the high rate of malnourished children and all. But then it comes down to the west and to the east. We also have those problems. So, by the time most, even the big NGOs, the UN, WHO, most of them, their camps and all are in the north. And then you come to wonder, we over here, what's our scope, what's our take? And then over here, it's as though NGOs are struggling to make impact. Go to Mokola, you see young children on the streets. Either they are begging for arms or they are hawking. These are issues we have, which is also there up north. You go to Gates at the spare parts. I don't know if you know the spare part market in Gates. You see young people, young boys. One of the days we have like, what can we do? They're just scouting for, just want to make money. And they're not going to school. Most of them end up becoming something else. Causing users in the community. So that's an issue, polarized interventions, where all attention is focused on the north. Then we also have teenage pregnancy issues. We have child marriage issues. But most times it's just over there, it's much in the north. But then it's as though we in the west, we are just, okay, we just get little. I don't even know if we've got to get prioritized. Yes, the north are being prioritized. Now to go back to this issue of the young people at Gates. One of the times just said they want to have a carry out a community outreach or intervention, one of the communities there. And then we went to the community leaders. They're like, these people, they all go out. They won't be able to come and listen to you. Some of the less that we did, mobilization, we went house to house. And they said, we will give them something. We don't have anything to give them. And then they don't go to school. So a lot of NGOs, even churches, religious organizations, just try to see what they can do. So the polarized intervention in Nigeria is something that is, for me, is something that should be worked upon. It should be worked upon. Yeah.
All right, thank you so much for shedding light on that. Now, one of the criticisms I've heard in the recent time about humanitarian work in Nigeria is sustainability. So, what can be done to ensure that humanitarian work in Nigeria is sustainable in the long term?
Okay. What can be done is this. Everybody has a role to play in ensuring sustainability, but we take it one step at a time. Now, if we have, if there is a proper coordination, from the government side, you have policies in place regarding some things, and then NGOs are kind of monitored, and then we have the mind that when we want to do this, we want it to be long term, we want it to be sustained. It's really not going to be. It's really not going to be an issue for us to be able to come up with projects, ideas that are sustainable and not just a one-off thing. So to do those things, you also need to be mobilized financially. You have to come to a point where the community, the people you are working with, accepts your idea. That's why we talk about working with communities. Okay. You don't just go into a community, into an area that you just say, this is what I want to do. You just do it. No. You go to the needs assessments. What do they need? Okay, this is what they need. And they say, let us work together to ensure we do this, to ensure this is achieved. Let the community own it. So when they own it, they find the way to they find a way to ensure that it's kept or it's sustained. For instance, all these water, you go to community, and a lot of NGOs, a lot of people, they try to open doorways for communities and all. Most of them they just do it, and then tomorrow it just gets spoiled. But if you work with the community, say that this community needs water, you work with them. You see that you need water. What can we do? Let's work together. Now, nothing you need to do, you have to use the local manforce. Let me put it that way. Whereby the workers, recruit workers from the community. In fact, they would recruit workers from the community and then ensure that, okay, work with us. This is your project. This is how you're going to do it. Tomorrow, even if they see a child going to touch that tap, they'll send the child away because this is our own thing. And so you know that with this thing, it's actually sustained. So NGOs will get to work more with communities, ensuring that you give them what they want, not what you think that they want. So,
okay, so you mentioned government the other time. So let me quickly ask that. What do you think the role of government should be in enhancing humanitarian work, Nigerian government, what their roles should be? Because looking at the work some of these humanitarian organizations, what they do, it's quite huge. And if they don't receive support from people, from the community and the government, but let's start with the government. What should be the role of the government in enhancing humanitarian work in Nigeria?
I think one of the things government should do is to put policies in place whereby you monitor these organizations, assess what they do, and see how far they are doing. Just come and work with them. You could enhance coordination and collaboration among NGOs. Look out for these young ones that are doing something. You have this idea, work with us. One of the times I reached out to, that's in your state here, I reached out to Riverside. Because we also work on do wash projects. I said, this is what we want to do. Like, it's okay, let us work together. At the point, I had it in mind that let us just be an implementing arm. Don't worry, we just go to schools, talk to them about hygiene and all. But then let us get our support from in any way. So I think government should come to a point where they also find a way to collaborate with these young ones because they have the energy.
Before we further that response, let me ask you, in your years of experience on this field, would you say the government have been forthcoming?
That's actually, we've actually worked with, they give you their support. They give you access to schools. Right? For instance, if you want to carry out a project here in your state, I want to go and reach communities, we want to get to schools, you go to the Ministry of Education, this is what I want to do. They say, okay, we work with you, they give access to schools, do this is how you, they'll give you contacts, but then the other aspects, the financial aspects. They want us to be obedient. They'll give you the support or something, and they'll give you updates on what to do and what not to do, and no. But then, in terms of finance or something, you can't say. But if you want that support, involve them in what you're doing. They will support you. The ministry, they'll advise you. They'll give you technical advice on how to go about your project. You want them to be there, you'll be there. They'll be there for you. But then, when it comes to the financing aspect and all, I really can't say much. But for me,
yeah, because I know I'm not at the federal level. There is a ministry that was created, the Ministry of Humanitarian and Poverty Alleviation. But so that was why I was asking that if we could have a ministry on humanitarian, so people might think that the federal government, or let me say government at all levels, should be forthcoming for humanitarian work, in as much the federal government has also key into that initiative.
Yeah, but then something about we Nigerians. Even though we do that, let us not rule out corruption in Nigeria. Corruption and lack of transparency and accountability. If we should have such instituted, maybe Ministry of Humanitarian, the government has to be on their toes to ensure that funds that are sent out for this is used for what it is sent out for. Right? A lot of things has to be around policy and then monitoring, and because most times some things could be siphoned. I know last time we were talking about organizations making use of, we can't rule out that. So, but I think when there is a system at work, in Nigeria, a system with a lot of things. But when there is a system at work, and then the government is sure that this is what I want to achieve in supporting young people, in supporting NGOs, I think they'll be able to achieve it. Yeah. Okay,
let me quickly take you back to the question I asked earlier about the sustainability.
Okay.
Now, looking at some of the humanitarian efforts that we do see, you might not have been to some of the communities where all of these things are being carried out, but looking at some of the things we do see on the media, like when it comes to humanitarian efforts, we see them giving out food items, mattresses, and all of that. But for me particularly, I think we should look at something that looks sustained for them, something that will bring food to their table, because looking at food items and all, they are temporal. So what do you think we can do to ensure that even on the part of the people that are receiving this humanitarian work, that at the received end, what do you think we can do to ensure that they have something lasting for them?
Okay, I think there's there are different areas. We talk of skill acquisition, empowerment. The governments, NGOs, individuals are doing this. So that won't just be that. There's an end that says, if I teach you, let me not just give you fish. Let me teach you how to catch the fish. So you teach people, you empower them. Okay, what skill are you interested in? What can you do? Some people are trained on farming, skills on agriculture, tailoring skills, graphics, what else do you call it now? Different skills, just to ensure that the work keeps going on. So NGOs now don't just give food and then stop. Okay, agriculture. There are a lot of programs on agriculture where young people are. Okay, I think sometimes I work with an NGO. I worked as a program officer. What they were doing, they were just empowering young people to go into agriculture. We taught them about the modern farming skills, and they are ready to give them a plot of land and give them seeds for just seed funding. And then after years, they just go back, okay, this is what you've produced. Some of them are into cucumber farming and so that's another way to sustain. Another way is through education. When they are enlightened, they will be able to. I know some people say, okay, go to school. When they go to school, they'll be able to, in fact, do things for themselves. So I think the government has another thing to do. If we can start from protecting human rights. Protecting human rights. These vulnerable people, what can they do? Are you going to keep them in a home? Are you going to equip them? Are you going to empower them? There is little or much that we individuals or NGOs can do. For instance, these young people on the streets, challenge, Mukola, what are we doing about it? I know some people they give food and all. But what can the government do? For them to say, okay, let's get a home, stay here. What can you do? You can do this or you can do that. But then there's a lot of work on mental You know, you just have to enlighten, re-enlighten. But most of this, sometimes the act and everything just is a mind thing. But if it's somebody you want to bring up from that state of poverty, you want to establish so that what you do is be successful, but they never want it. You understand? I think I saw something online, an organization, they met with a young man. I think okay, that should be in the north. Okay, you have so many number of family. Okay, take this money, take this land, farm, do this, do that. I think you know what he did? He went and married another wife with the money that was given to him. So even before you want to do something lasting, these people must have a change of mindset. So I think it's quite encompassing. So I said, okay, let us give it the little we can do for now. Let's live for tomorrow. When there's life, there is.
In some case you just mentioned, I think follow up, like you.
Yes, follow up. We are monitoring, following up, and then ensuring that you're doing. It was in the place of follow that they discovered that he used the money
to marry another wife.
You know, so. Now that comes to tell you that individual needs differ. What I want,
differ.
So if you want sustainability, you want this thing to be. I just love my beggarly life. So there needs to be real orientation on that. So a lot of things and just
it's a lot indeed.
Yeah.
You were about to mention some of the challenges that NGOs and people in humanitarian business do face. So what are those barriers that comes with humanitarian work in Nigeria?
Okay, as I said earlier, I talked about the security issues, and then we talk about social cultural barrier, you know, and then we talk about infrastructure. The issue of lights. In most NGOs, let me just talk about that. When you play where there is no, we don't have access to light, access to water. These are just basic needs. So the issue of power supply, access to basic issues like water is a big problem in Nigeria. Now we're talking about NGOs, even lack of access to healthcare facilities is a problem too. Imagine if for instance, I'm in a community where there are no issues, where there is no basic, you go to the primary health care center and they're just, there's nothing to write home about. It can prevent my work there or something. I talk about the people in the community. You understand what I'm trying to say? And then when we talk about the issue with funding and the lack of collaboration among people, lack of funding, lack of access to these funds, they are all challenges that we face in the field. And then community engagements and then what else do we talk about now? So basically, that's actually what
okay, you talk about collaboration with who, and talking about humanitarian work, I think it requires both collaboration and strategic planning. So how do you go about these two, because they are very key?
Collaboration in the sense, when I talk about collaboration with the government and with other NGOs, all right? And the strategy, when you talk about strategic planning, you're looking at it like, this is what we want to do. Let us come together to see how we can ensure that it is carried out with minimal cost, all right? So collaboration with government, collaboration with international bodies, collaboration with communities, collaboration with churches, all these things, they just go hand in hand to ensure that these humanitarian services are carried out well. So those are basically some of the challenges we face. Another challenge we actually face is, we talk about this issue of environmental issues, flooding. You know, the last flood happened in Borno, Maiduguri and all. Flooding, desertification, all these environmental issues that affect our programs, our works. Imagine an area that's prone to erosion. You wake up in the morning, you realize that there is sounds like erosion has spoiled the road, and you won't be able to go to wherever you want to get to. So those are actually basic issues that we NGOs face. Yeah.
So to many Nigerians who might be watching us at the moment, how do you think individuals, Nigerians, can also come on board to ensure that humanitarian work in Nigeria is being improved on?
Okay. Individuals, one of the things individuals can do is to volunteer. Volunteer to support any organization around, and then commit to awareness, social media. And when I talk about social media now, mind where you post. A lot of things happen on social media. Don't post the wrong information. You see these organizations around, you could support them by sharing their works, sharing their works, sharing information, and then in your own little way, if you can support with whatever you have, and then ensure that in your own little way you are doing the right thing, communicating the right thing, sharing awareness, and then volunteering with them. That's what you can do as an individual to see that humanitarian work is going on well. Yeah, the little way you can just.
The issue of funding, it's also very, very important to do all of these things. So how do you source for fund for humanitarian work? As in, are there some sponsors, or where do you get the money from?
Where do you get the money from? Personally, most times funds are personal funds. Friends contribute. For instance, now, next week is the Valentine's. And among young people, their bellies are filled with butterflies already. And that next week, to us health workers, is a crucial time, because the issue of teenage pregnancy, STI, in fact, that's the peak of it in the year. Because see, these young people talk about love. They just want to go and do one or two things. That's where they explore, and that's where some of them be in school. 14th is Friday. Oh, go check their attendance. Some of them may not be in school, but they may be in school. So that next week, a lot of programs will be going on all over the country by non-governmental organizations. And now we're applying the program. And I was like, how are you going to get the money? How are you going to get the money? One of the things we do now, I said, capital active friends, okay, can you support us this way? Can you support us this way? And then, if you're part of a bigger organization, most times we collaborate. I think most times we partner with some organization where they can't give the money, they can do in kind. They can say, okay, come and use my office. Okay, I have this too. All right, I have this. Can you make use of this? So basically, for us now, we personal funds, friends, basically, and then one or two organizations could just say, okay, take 50,000 naira in support. So that's how we raise funds for what we do. We're still hoping that we'll be able to win grants someday. Of course, we've been applying for grants. But not all the challenge, we just get to the peak, but I'm sorry, we won't be able to fund this project again. That's not a challenge. But this year, we're believing that we'll be able to win some grants around the corner.
Okay, let's talk about what you do at BHS. That is Blessed Health Spring Initiative. Okay, before we talk about that, let me ask you that. What prompted you to go into humanitarian work? Is it your passion, or something do you have dreamt of, or is it something that I saw my parents doing this and I want to go into it? Okay,
so as a young child, I grew up having health issues. I'm from a humble background, and so I wanted to be a doctor. I felt if I'm a doctor, some of these things, and most of them are just preventable. So I just said, okay, fine, this is what I'm going to do. I'm going to study medicine, but because my parents didn't have the wherewithal, I said, okay, let me change course. Let me go for public health. With public health, I'll be able to touch lives. I'll be able to let people. I'll be able to inform people about diseases, about preventing diseases. Actually, so we don't fall victims of these that are preventable. Some of the things we pass are preventable. Malaria, other stuff, they are preventable if you know what to do and what not to do. So I went in for public health. I started my course. This is really what I wanted, but yes, I found fulfillment in the course. The one thing that spurred me to go actually spurred me to open up this organization and reach out to young people was this. I traveled on one of the days and I saw a little girl, basically 14 years. She was in primary 6. She had given birth to a child. And she had rashes all over her body. And finally, in her we were like, she has gone to Ogaraburu, She has gone to carry one disease like that. It's a man that gave it to her. And then she was bragging with the fact that she had a child. And then her auntie, her mom's sister, she was born out of wedlock actually. So her mom's sister who had been married for over 5 years got an issue. So she was bragging with that. And they didn't see the need to go to school. And she was still nursing her baby. And she still had all those rashes all over her body. I was like, God, how will young people be like this, And then I said, I saw the need. In fact, I saw the need to go and reach out to young people. Make them understand that there is more to life. even as much as you're from a poor background, wherever you're from, you can be better. And then you don't need to be victims of these things. So with that, I opened up our organization, reaching out to young people, empowering them to make healthy, informed choices, and equipping them with capacity to build world relevance. And so over the years, we've been carrying out programs on teenage pregnancy prevention and STI, among young people. And then we'll be carrying out projects on menstrual hygiene, even teaching people how to make reusable pads. And then during COVID-19, we reached out to communities, sensitized communities on COVID-19, give relief items. And then obviously one of the programs we started up was a mentoring session. We had to include boys. Most of them just girls. But also we need to include boys because there is no need empowering the girl child, talking to the girl child, and then you leave the boy. It's the boy that will come and do whatever he wants to do, right? So we had this young girl that got pregnant. And her parents, you've done this. Why do you do this? You put shame, you brought shame to us, And then we said, okay, fine. With other young people, we had someone that wanted to say, blessed, I want to support some people to write JAMB. Okay, fine. We put them trying to write their JAMB, and then she, as God will have it, she got the JAMB. She passed her JAMB. She gained admission, and now she's in school. Yeah, she's in school. And so you see that each day young people face one or two things, and then we are there to ensure that they don't fall victim to preventable health issues. And then sometimes I also try a program on mentoring, Made for More mentoring. We had to reach out to young people that were pregnant and that had babies in hospitals. We had to talk to them about family planning, so that they can be able to plan their future. So the most times when they get pregnant like that, especially the females, they feel that's the end of my life. So we had to make them understand that there is more to what they can be, make them identify what was your passion before now, you can go for it, and then we follow them up. So another thing we do, we also do wash projects, hand washing and among young people. So basically, those are the things we've been doing over time.
At BHS?
Yes, at BHS, Blessed Health Spring Initiative.
Blessed Health Spring. And how old is Blessed Health Spring?
It's 4 years. 4 years. Yes, we got registered with CAT in 2021.
Okay.
Yes, to be precise. But that's officially 4 years. But we started our projects in 2019. Yes.
All right, I've been having this amazing conversation with Blessed Peter Akinluyi, the founder of Blessed Health Spring Initiative, a non-governmental organization, and we're looking at humanitarian works in Nigeria. It's been an insightful time, I must say, with you, and I want to say a very big thank you to you for coming on the program. But before I let you go, perhaps we might have one or two individuals who might be watching us today, and they might have passion to going into humanitarian work, but looking at some of the challenges bedeviling the country at the moment, it could be a setback for them. So what would be your word of advice to them?
Please don't let anything take you back. It may be the reason, it may be the hope for someone tomorrow. It may be an answered prayer to someone, yes, especially we're answered prayer to some people. The little we have, we're able to equip young people with skills, and when you see them doing well, you feel fulfilled. So it's not just about what's happening around. What exactly that gives you fulfillment? Does it give you joy? Someone said, blessed, you're not being paid. How are you? I said, I get fulfilled. Seeing someone is doing well, saying that the humanity is doing well and faring better. So don't just sit back, don't be discouraged. Once you get there, support will come. Anyway, as long as I know that this is what God wants me to do, and I have the backing of God, there will be a way out for it. So keep hope alive and do that thing you need to do while there is still time.
Exactly, while there is still, so don't procrastinate.
Don't wait till too late, not maybe too late.
Yes. So be an answer to somebody's prayer. That's very key, and a very big thank you to Blessed Peter Akinluyi for this wonderful time on the program, I must say.
Thank you very much for having me.
Coming. And I think it's huge. Humanitarian work in Nigeria is immense, and we want many communities, organizations, individuals who are well to do to also see a way how they can put smiles on many Nigerians' face who are going through a lot, who needs financial support, mental support, and health support as well. So especially health, that is very, very key as well. So many organizations that are well to do that they can actually go in some of these humanitarian efforts to shape the future of Nigeria. So we look forward to more people investing in humanitarian work. That's how much we can take on today's episode of Frontline this morning. Once again, thank you to Blessed Peter Akinleye for this wonderful time on the show. We'll see you again tomorrow by God's grace. Until then, my name is Temitope Oladipo. Do enjoy the rest of your day.